So, in looking at this, I guess you're probably thinking it's a good thing that I didn't try to become an artist as my career choice. Probably a smart decision. Anyway, what I'm trying to show you with the diagram here is how the shoulders can be causing pain down here at the lower back, and how problems at the back can also be causing shoulder pain. Pretty interesting thing, because a lot of times we don't see the connection with the two, or we think that they are separate issues. And it's real easy to throw a bunch of exercises at these issues that merely address the symptoms. And that's why a lot of the corrective exercises that are used to address problems at the shoulders or problems at the lower back, why a lot of them don't work, or they really get very little or minimal results at best. And the reason why is because a lot of times we fail to see the connections. We're not identifying really what's going on behind the scenes of it all, right? So when we're looking at the shoulders, it's really interesting because there can be mobility issues at the shoulder that affect how we're moving, and that will create problems at the back. So if we think about it, if you've got somebody, or maybe you've got shoulder problems yourself, but think about if there's some mobility issues, there's a lack of mobility at the shoulder, what that's going to look like every time you are doing any kind of movements around head level or overhead. How many things we do, reaching up into cabinets, hanging things, taking things down on a wall, or climbing a ladder, overhead activities like swinging a golf club, a tennis serve, right? Or even simple exercises, shoulder presses overhead, things like that. So what will happen is when there's a lack of proper mobility, it's going to alter the normal movement of the shoulder. So when you can't get overhead, what's going to happen is you're going to start to overcompensate by using the lumbar extensors. You're going to have to lean back to get yourself into the range overhead that you're trying to get. So what that does is it may not do a whole lot of, or cause a lot of problems, over the short term, but the longer it goes on, the repetitive overuse of the lumbar extensor starts to increase stress to the lower back. So a lack of mobility at the shoulder can be affecting the lower back. And part of the problem in a lot of cases with a lack of shoulder mobility, it doesn't always have to do with just the pectoralis major or minor being tight. That could be part of it, but a lot of times we just assume that. If we see somebody with a rounded posture, we just assume we're going to do a lot of chest stretches, might do some upper trap stretches. But when we look at it, here's a big link between shoulder problems and low back problems. It's right here. That guy. What that is, my poor drawing again, that's the latissimus dorsi. So really, a lot of times, a tight lat can affect the shoulder. So a tight lat will pull that shoulder forward and in really tight. And because of the attachment here, all the way down from the thoracic to the lumbar spine, that attachment can create a lot of stress. So when it's real tight, there can be a lot of pulling, a lot of shear. Especially if the lat's tight and you're trying to reach overhead, and you're trying to stretch that lat out and it's tight, it's going to start to pull at the low back. All right, so you can see a lot of problems could start to happen from there. All right, now what happens in the reverse scenario? Can the back be responsible for shoulder problems? Well, definitely. And that is because of this area right in through about here, what I call the upper back complex. You might call it some of the mid back as well. But when there's a weakness in the scapular stabilizers, that can also lead to that forward rounding posture. So we have to ask then a question. When we're looking at ourselves or at our clients, is there an issue of tightness that needs to be addressed? Or is there an issue of weakness across the upper and mid back complex that need to be addressed? It's not always both. Right? It could be one or the other. Sometimes it can be both. Tightness can lead to weakness. But just because one exists does not always mean that the other exists with it. All right, so you can have tightness in the anterior muscles, or what could appear, I should say, to be tightness. You can have a posture that assumes that, but unless you really assess and identify what's going on at the mid-back complex, sometimes you can have that appear to be tightness when you can merely train those muscles in the upper mid-back complex, and all of a sudden posture is restored, mobility is restored, and things look good. So spending time just doing chest stretches and things of that nature for a case where tightness isn't the main factor, it's not going to be the most effective use of time, and you're not going to get the best results with your clients. And that's also a reason why most corrective exercises like TheraBand, rotator cuff exercises fail to work at solving shoulder problems because, one, they are performed in non-functional ranges, doing rotations, external rotations, pulling here to here, internal rotations. They're not functional ranges of motion that we use outside of the gym setting in our everyday lives, right? We're moving, reaching overhead, moving in diagonal movement patterns. So those are the things we have to address. And the second problem with things like that is they don't address this mid-back, upper back complex. Symptoms at the shoulder do not always mean that the shoulders are the problem. They're just a symptom. Again, we have to identify the true cause of the issue that's producing those symptoms to effectively reduce or eliminate the symptoms altogether. So until that upper mid-back starts to get addressed, all the TheraBand rotator cuff exercises in the world aren't going to do a whole lot to restore proper movement at the shoulder through functional ranges and keep somebody pain-free, all right? And the same thing with the lower back. We know we need to address core stability. We know how effective abdominal exercises can be. But the problem is that most of the time, the way that we're trying to apply the application methods we're using are not in movement patterns that we exist in our everyday lives. We tend to favor doing crunches on a stability ball or leg raises, things like that they're not functional applications, and they can also have negative effects. Why, case in point, if you do crunches too much, overemphasizing contracting the rectus abdominis, you'll end up with a posture that looks like this over time. And I don't know about you, but trying to do a lot of activities where you got to bend down or you got to lift something up with a rounded, hunched back like that, probably not very good. And look at what it does with the shoulders as well. All right, so that's just some food for thought today about how shoulder pain and low back pain a lot of times are entwined. So it's important for us to be able to identify the true nature of what's going on and the links that are often associated with what's going on in the body. All right, so give it a go. Let me know what you think. Leave me a comment below. And I guess that's another reason why I'm not a poet for my career. All right, I'll talk to you later.